What happens if something doesn't heal right after plastic surgery? Well, first of all, it's very important that you trust your doctor to make sure that that person can deliver the results that you're after. So for me, when I sit down with a patient who I just meet, the critical thing in making sure that patient's happy with the results is setting expectations, because people are going to be a better version of themselves. And we spend an hour going over all the risks, and everybody heals so differently, so we can never ever give guarantees. So if somebody doesn't heal right, first of all, most of the time we do have to wait, because things definitely do improve over time. Some people heal real quickly and some people take much longer, but there usually are changes and improvements that can happen for many months and up to a year. But if at a year or even sooner sometimes, if something isn't as good as it can be, or if it could be improved, sometimes we do revisions. Scar revisions, typically you have to wait for the scar to be mature and not red. So you're looking sometimes at a year out. Sometimes we can do things sooner. And if it's something small, we can do a scar revision in the office at no charge and get that patient with a result that they love. Because there's so many factors that we can't control with respect to healing. Because when I leave the OR, everything looks as perfect and as good as possible, but I'm depending upon that individual to heal everything. And some people just heal better than others, and you can't control everything. So there's always risks of needing a revision. And in my office, if someone needs a revision and I can do it in the office, there's no outward fee, so they don't have to pay for anything. I'll just include it because I want that result to be as good as they do. It's a reflection of my work, so I want it as good as it can be. If it's something more involved and I need to go to surgery for that, I won't give them a surgeon fee, but there would be anesthesia fees and OR fees. And that just depends on how long I'm in surgery. So a 2-hour case can cost about sometimes $2,000-$3,000 for those outside fees, sometimes even longer depending on what facility I'm at.